Well, that's extremely important to convince patients that iron deficiency is an important comorbidity, very often present, and although intuitively by a patient and by a physician linked with anemia, very often not really. In other words, at least half of our patients with heart failure tended to have iron deficiency with pretty normal hemoglobin. So question number one, I have normal hemoglobin, so how can I be iron deficient? Iron deficiency is about anemia. It's not true. Half of this is with normal, and how is with a low hemoglobin level. Second problem is, why not I take iron orally for a long time? It will help me. I don't need an injection. Again, it's not true, because even if you consider this positive and a true message, then you need to give the iron for, say, 6-7 months, and on the top, which is a little bit of a problem. But the second issue is, as I mentioned, iron out study show the results of this study clearly demonstrate that oral iron doesn't work. So in other words, if something works for healthy subject, does not necessarily work for the for patients with heart failure. So oral iron doesn't work. What about safety? Is this for many elderly patients who tended to remember how IV iron compounds were toxic in the past with a lot of adverse reactions, they somehow learned that it may well be dangerous. We can explain this, that with a novel compound, the risk is virtually negligible. We haven't seen, we have not observed any really adverse reactions, life-threatening. So safety, and the product is safe, product is well tolerated. And maybe most important question, what would be the benefit? And this is how we discuss this with our patients, telling them that at least part of their symptoms, their character, the nature of their symptoms, which is very often weakness, poor exercise tolerance. I can not walk. I am not able to do my everyday activity, is related to iron deficiency without explaining the background, which is not easy because we still do not quite understand. And I think that if we say iron deficiency is about poor energetics, so we simply correct this and we explain to the patient, by correction, you live better. And we can also now say that we reduce the risk of you being admitted to the hospital with deterioration in your symptoms. So I think it tells to the patient the whole story and covers the whole story. That would be my simple explanation.